Move on to our next speakers, Dr. Marc Miresco and Ashley Tritt. So Dr. Miresco did his med school and residency at McGill. He's the Director of External Services in the Department of Psychiatry at the Jewish General Hospital, and his main focus has been clinical psychiatry, but over the years he's also spearheaded various eHealth projects. He is the founder and editor of psychvisit.com, which is a website that offers information and treatment guidelines regarding a wide range of psychiatric disorders. Several years ago, he created a website offering home-based telepsychiatry in Canada, and more recently, he's been leading the development of Aminy, which we'll talk to you about today. It's a mental health symptom tracking app. Ashley Tritt is a medical student at McGill University. During her undergraduate degree, she founded the Canadian chapter of Project HEAL, an international not-for-profit organization, as well as she's also one of 30 principal applicants for the chosen group of a national $25 million initiative to transform youth mental health care in Canada, so the ACCESS project. She acted as youth lead of ACCESS for the first 2 years of the project, helping recruit youth from different settings, as well as facilitating youth engagement efforts. So we're happy to welcome Dr. Miresco and Ashley Tritt.
All right, hello everybody. So today I'm here to tell you a story about developing an app for psychiatry. And this story starts with an idea that I had several years ago, an idea not at all original or unique, to try to implement a computerized way of allowing patients to track their mental health symptoms on a daily basis. Why am I so excited about symptom tracking? It offers the promise of having a high-resolution view of patients' symptoms across time. It can be used as a diagnostic aid, basically collecting extra information that we don't always get in our clinical encounters. It can help for remote monitoring. That means that I can see how one of my patients is doing in between sessions when they're at home and I'm in my office. It could potentially improve patient engagement by allowing patients to become active partners in their care and helping them to also understand their illnesses better. And it also offers the promise of precision medicine or personalized health. What this refers to is, how can I know what specific treatment would be best for the patient in front of me? And we don't know how to do that yet, but imagine if you can collect a very large database with many, many patients who are inputting their data on a regular basis. You can create a very large database that you can then mine to basically answer these same questions. So just before we heard the comment about Google, for example, that uses your past history to know what searches you are most likely to make. When you have information like this, you can start to make personalized predictions about individual users. In the end, it's all about the power of information. And I like to use the analogy of the stethoscope, which is one of the most recognizable symbols in medicine. But what it really is a tool that enhances the doctor's abilities to understand what's going on, to increase their powers of observation. And it reminds us that some of the greatest advances in medicine have been made by tools that increase our ability to observe and to offer new ways of seeing. So this sounds simple, the idea that we're just collecting information. But then when I started to think about what are the types of features that would be necessary for this kind of app, you realize that there are many important features, such as information security. You want the app, if it's collecting health information, that it should have the highest standards of security and encryption. We're living in Quebec, it should be bilingual. It should be applicable to multiple conditions. That's important. Many apps out there, and I should mention that there are many, many symptom tracking apps that you can already find out there on the app stores. A lot of them are focused on one specific condition, depression, anxiety. Yet we have patients coming in with all sorts of conditions. One patient can have many conditions. It becomes unwieldy to start to use many different apps for different patients. So that I found to be a big constraint. And finally, is the app validated? Meaning, is the information that it's collecting something that's meaningful clinically that professionals can use and understand? So my first attempt at this was a few years ago using a website. It wasn't a mobile app. And I learned a lot of things from this project, where it was basically a website where patients can document rate their different symptoms on a daily basis. They could even create their own symptom titles. And it seemed like a great idea, very, very, obvious, but it didn't work at all. It was pretty much a failure. But I learned a lot about that. I learned that most patients don't use their computers very often. People are using their phones and their tablets. So patients would have to think, tonight I have to go on my computer and log in, and they would just forget. And then when they were logged in, it was a bit cumbersome to have to, for each symptom, you'd have to open this little pop-up and rate it. It took time. It was not very convenient. And most importantly, there was no feedback. Patients would give their information and nothing would happen. It's kind of throwing your information against a wall, and at a certain point, when there's no feedback, you kind of just drop it because you don't see how this actually helps. So this comes into the whole idea of user experience design, or what they call UX, where the devil is in the details. And how do you really develop this tool that could work for everybody, that people will want to use? Because after all, the problem should be simple. Patients, in theory, want to share their information. Clinicians, in theory, want to hear this information. The technology exists. It's affordable. Why aren't there apps out there that really meet all the criteria that I'm hoping to find? So the whole idea of user design is that you're really looking into how can we make the experience optimal so that users will continue to use this tool. And basically, it's obvious that if you want to know how to get users engaged, you want to work with the users. And so that's why this project became a project, what we call participatory medicine, where it became a partnership with patients and families. This app, importantly, is not just for patients, but also for their family members. And that's how I met Ashley Tritt. It was already a couple of years ago. And she was leading a group of extremely dynamic and engaged and passionate youth who were patient advocates, and tried to understand from them what they would want from this kind of an app. So I'll turn it over to Ashley.
So hello. Our experience working with Marc and our group of young people was really, really interesting and really engaging and so much fun because we learned a lot about what young people really want from these types of apps, because there are a lot of these apps that exist, but I don't know of any from the feedback we got from our youth that are actually used on a daily basis. And so we wanted to tap into that to try to see what we could do to create an app that would make young people affected by mental health actually want to use an app to track their symptoms and feeling like it was something they wanted to do on a daily basis versus something they felt like they had to do on a daily basis. And so just an introduction. So a lot of the motivations for participation was kind of just a general feeling that current apps on the market don't really fit the needs of the young people. There's a lot of redundancy, there's a lot of repetition, and a lot of them aren't designed by the targeted users, which are the young people. A lot of the young people felt like there were 40 things they had to do once they got into the app, and while they're already feeling overwhelmed, those extra 10 minutes to input their data from the day was just too much. They wanted something a lot simpler that was going to be very convenient. And also a big part of this experience was learning that the young people really wanted this app in order to have a modality for regular communication with their clinician, even if that meant, it just meant that their doctor was just getting the regular reports of how they were doing to feel like they were better engaged in their healthcare. And so what we did is we tapped into those needs in order to get a youth group to help in the design of the app, in addition to the app features. And so we had young people consulting on each step of the application development. And it was really, we created a process that was really centered around the youth needs and also their feedback. And we would follow up with every young person to ensure that they saw that all of their opinions had been incorporated, which was really successful. So the goal was to design, again, something you would want to use versus something you felt like you had to use. Okay, so just some quick notes about how we established our team. So we targeted youth leaders from our own personal and professional networks. We targeted young people interested in mental health, and especially those with lived experience. And so how we set it up was we had an initial meeting to kind of pitch, to gauge interest. Is this something that you would want? Is this something you would be interested in helping to develop? Through that, it was a web-based group video chat where we kind of saw what the opinions were, what the fears were, the hesitations, any criticisms. Why do you think this wouldn't work? Why do you think this would work? And then we followed everything by an anonymous survey to really make sure that we were really helping to engage users in a safe and honest and genuine experience. Okay, so a lot of the young people expressed, for example, why do I need, why is there a need for Aminy? And so as you can see, because I want my voice to be heard, not interpreted, my emotions don't fit into a box, I need to feel I'm expressing myself and that I'm not being forced to fit into a pre-assigned mold. You already feel like you're a burden to your doctor. So if info is streamlined, already sent, you feel less bad. They can see I am struggling and can help me succeed regardless of what I am going through. I need to notice a trend so that I can have control over my symptoms, so that I can exhibit behaviors that work and inhibit behaviors that don't. The app to help as a reminder that I need to take care of myself first and foremost. So really centering it around the young person. Okay, so this is kind of just our process. I'll go through it very quickly, but pretty much we used all communication modalities according to the young person preference, and pretty much we were able to tailor the level of participation of the young people depending on how much they wanted to be involved in order to allow a wide variety of participation on a spectrum so that we can get, very broad opinions. Okay, so as you can see, Group 1 was our primarily involved young youth group, and they were really instrumental in every step of the process. We had 12 members, 9 of whom self-identify with lived experience, and 6 of whom identify as visible minority from across 3 provinces. And Group 2 was more of a less involved, a little bit more of a consulting role, as well as doing some beta testing later on in the process. Again, 12 members, 5 of whom identify as a visible minority, a little bit broader in age range, 12 with lived experience, and from 4 provinces. So the next step was kind of getting, really tailoring and having individual personalized interviews with each youth member in order to really find out what that individual person would need in order to want to use the app on a daily basis. And so what we did is then we actually created a summary after of all the youth opinions, sent it back to the young people and said, okay, were we correct in summarizing this? Do you think we missed anything and what you would need from the app? So it was really like the young people were the leaders in this, and we were just trying to help express their views in order to create the app. Okay, so again, how we realized that youth engagement was an equally important process in this, if not more. And so really the same kind of mindset that we used to see how the youth would want to be using this app on a daily basis, we also tried to apply that of how can we make also youth want to be involved in this process, because I think that youth engagement and that excitement and that, that enthusiasm translates it in all spectrums when involving youth in a process like this, both the app and the actual process itself. Okay, so this is just how we kind of, how we validated and how we examined whether our youth felt satisfied in the process, etc. Okay, and so again, everything was validated. We would go back and really make sure that, is this, did we get a good sense of how you felt? Did we make the changes on Aminy based on your feedback? Is there anything we're missing to make you feel you would want to use this on a daily basis, etc.? Okay, and so I really want to drive home what we learned from this process, in the sense that something that was super, super, super important was that the young person really wanted this to be feeling like it was a way for them to be fully understood by their doctor, apart from the half an hour follow-up that they would get regularly. This was some way to provide their doctor with even more information, even more detailed information that they could choose to really be able to express themselves, and also regular communication with their clinician. I know that's a topic in itself, but really being able to feel like their information and all this effort they were putting in was actually going somewhere, because a lot, we would ask them, well, what happens if your physician doesn't want to participate or can't? Then a lot of them did say, some said, I would still want to do this for myself, but many of them did stress the importance of someone seeing the data. Someone who is important in their life, important for their care, seeing this data, and also to be able to really feel a little bit more in control of their mental health, and to have a youth-friendly medium to do so. And also as a reminder to seek help, as a reminder of well-being. There is this big trend on self-care with all of these wellness apps, and I think that this project taps into that, but also in a clinically relevant way, and kind of linking it with mental health care. So it was a really wonderful experience.
Thank you. And so I tried to use a similar approach also to understand the perspective of family members. It wasn't as involved and as elaborate as what Ashley was able to do, but I met with a few family representatives from the Access Network, one of whom sees here, Leah. And they explained to me what, from a family member who is living with a loved one who has a serious mental health problem, what they would want from this kind of app, which included a desire to relay their observations, to remain informed about what's going on with their loved ones, and wanting to assist in their loved one's recovery. So putting all of these things together, the idea that came up with was, well, what we understood was that symptom tracking will only work if it's a form of communication and part of a conversation. And that's the kind of spirit we tried to infuse in the app. I spoke about the patient perspective and the family perspective, but there's also the clinician's perspective, because there's three main users that are using this app. And here, the feedback was perhaps more nuanced, and there's actually a lot of information already out there in the literature describing clinicians' perspective on eHealth tools. And clinicians have many concerns, actually. Will I be bombarded by messages? What about treatment boundaries? Especially in mental health, that's very important. What about patients with borderline or suicidal tendencies who may send messages saying that they want to kill themselves? What about the medico-legal risks? If I get a certain message, do I have to respond immediately? Will I be responsible if I don't? Especially in the US, you hear this concern a lot. Am I reimbursed? If I'm not being reimbursed for this work, will I be motivated to do so? So these are all very valid concerns, and again, I'm not going to have time to go through each of these, but if you have questions, these are things that definitely have been thought about and addressed. But just to give you an idea that there was a study done in 2011, a Canadian study, showing that clinicians are already using these types of tools. 72% of Canadian mental health professionals, that includes not just psychiatrists, psychologists, social workers, psychiatric nurses, will be using email with patients. The use of patient portals. For those of you who don't know, a patient portal is an app that allows patients to use a bunch of different features to connect with their clinicians, messaging, scheduling appointments, basic information. The use of these are rising dramatically, especially in the US. And in some specialties like obs-gyn, dermatology, internal medicine, text messaging is actually starting to increase to exceed face-to-face visits. So it's really becoming mainstream. And there are documented benefits of using patient portals and personal health records. These are basically apps that are used to engage patients where they can see their health information and also communicate with their health professionals. In medicine in general, not just in mental health, but in general, there's evidence that using these tools improves productivity with decreased office visits and decreased telephone calls. In mental health, specifically in psychiatry, there's a few studies, and I've included them in the handouts, that show that there are improved quality of medical care for patients with psychiatric problems when they use these apps, that they tend to use medical services more frequently, they're more activated. These are measures of patient engagement. Basically, they become more active partners in their health, and they're more proactive at using resources. They end up having higher recovery scores, and there's better organizational efficiencies. But I'm almost done, and kind of one of the important take-home messages from all of this is that all of these tools involve some level of messaging, where patients are able to communicate directly with their clinicians. And this is really important. And this is, I think, where we're going to see how this app plays out, because I spoke at the beginning about what I see as the power of information, how the information can help us. But from the clinician's point of view, there's a bit of a danger or reluctance to have too much information. Many people have asked me, in fact, one of the features probably be adding to the app will be a feature where clinicians can choose to shut off their messaging feature, because many clinicians have told me directly, I'm not comfortable using this app if there is going to be a messaging feature. I'm curious to see what's going to happen. My prediction is that those cases where the clinician has turned off the messaging feature, I predict that patients won't use the app as much or at all. Because, and I could be wrong, but my prediction is that symptom tracking, this kind of an app, only works if it's part of a conversation, part of a form of communication. Just to end very quickly, so it's already been started to use. I've been using it with my own patients, a colleague of mine as well. So far, 55 patients have downloaded it. We're just kind of testing it, working out the kinks. But what's interesting is that of these, 45 patients have used it within the last 10 days. So that's more than 80% of patients are using it actively. That's a pretty encouraging statistic. Usually more than 60%, if you have more than 60% of users who are using an app on a regular basis, that's a sign of success. So hopefully we're on the right track. Thank you.